Hello, this is a virtual pathology specimen of the heart with the ascending aorta in the thorax, and the diagnosis here is aneurysm of the ascending aorta. We can see here that this is the left ventricle that has been opened, and we have part of the mitral valve here. Over here is the aortic valve and a little bit of the right ventricle here. Rotating this, we can see a little bit more into the right ventricle, and then posteriorly we have the right atrium, right ventricle, and again the left atrial appendage. There is a marked dilatation of the ascending aorta, and if we look more closely within this dilated area of the aneurysm, we can see that it is filled with this laminated structure. We have these pale layers which are composed of fibrin and platelets, and these alternate with darker browner areas which are composed of red blood cells. So if we take a look at the labels here, we can see that this is the area of the aortic aneurysm, and these are known as lines of Zahn, which are very characteristically seen in arterial thrombosis. Let's take a closer look at aneurysms. They are defined as localized abnormal dilations of a blood vessel or also the heart. And there are true aneurysms, which we are focused on here, which means all layers of the vascular wall or the wall of the chamber of the heart are dilated. There are such things as false aneurysms, which are also known as pseudoaneurysms, and this is really more of a defect in the vascular wall, and the blood actually communicates directly with the extravascular space. These are not true aneurysms. In terms of the gross appearance, there are two main shapes of aneurysms. We have the saccular aneurysms, which means it's more of a localized outpouching. And we can see an example here. This is the abdominal aorta, and we can see that there is this localized outpouching. Or we can have a fusiform shape, as we can see here. Again, this is the abdominal aorta with its bifurcation distally, and we can see that the entire circumference is dilated. Also, very clearly, we can see that the intima is involved with these numerous fatty, bright yellow plaques. And this tells us that there is underlying atherosclerosis. So among the causes of aneurysms, atherosclerosis is one of the commonest causes, especially in abdominal aortic aneurysms. Hypertension is also a very common cause, and there can be underlying conditions that can give rise to aneurysms, for example, connective tissue diseases like Marfan syndrome, infections as well, which are known as mycotic aneurysms, and the infectious agents can be in the bloodstream. Once they involve the vessel wall, they damage the wall and weaken it, predisposing it to aneurysm formation. Vasculitis, inflammation within the wall of the vessel, can also give rise to aneurysms, and the mechanisms of all these causes are usually due to damage or reduction of the extracellular matrix, especially the elastic fibers, which actually form a very substantial proportion of the wall of the aorta, giving rise to its ability to recoil and also to reduced smooth muscle cells. So all these will lessen the ability of the vessel to recoil and therefore predispose to aneurysm formation. Some of the complications would include rupture, which can be potentially catastrophic. Imagine a large vessel like the aorta. If there is free rupture of the aneurysm, this can give rise to exsanguination. Thromboembolism can also occur, as you see in this case that we have been looking at. The reason for thrombosis is because of disruption of the laminar blood flow, therefore giving rise to turbulence and stasis. There can also be obstruction of the branches of the vessel. For example, if the abdominal aorta is involved, the renal arteries may also be obstructed, giving rise to ischemia of the kidneys. And even impingement of this large aneurysmal dilatation on adjacent structures. And here is an example of an abdominal aorta actually eroding into the spine. Let's take a quick closer look at this. These specimens are all taken from our virtual pathology museum from Pathweb, our online pathology resource, and you can register for free. The link is in the video description. So here is an example of an abdominal aortic aneurysm, and this is the vertebral column. And we can actually see that this aneurysm is eroding into the vertebral bodies as well as the discs. And this is how adjacent structures can actually be physically damaged from the sheer size of the aneurysm. Here is another example of an aneurysm, and in this case, this is a saccular aneurysm. We can see that the wall of the aorta has a very prominent yellowish atherosclerotic plaques, and therefore we can already surmise that the underlying condition here is atherosclerosis, and here is the area of saccular dilatation and aneurysm formation. So if we look carefully, we can actually appreciate that there are some brownish areas here, and this is an area of thrombus formation already. So there is a danger of thromboembolism. Hence, in summary, this is an example of an aneurysm of the ascending aorta in the thorax, and within this aneurysm we can see thrombus formation with lines of Zahn, and one of the complications here is obstruction or impingement on adjacent structures, obstruction of the branches that exit from the aneurysmal segment, giving rise to ischemia, and also thrombus formation with potential thromboembolism. And of course, a very important and potentially catastrophic complication is rupture with massive hemorrhage and potential exsanguination. Thank you.